In this presentation, we'll be doing a very brief overview of some of the radiographic procedures performed of the reproductive system. Most are performed under fluoroscopy, and overhead views are typically very limited to reduce radiation exposure to the patient. The procedures performed for females can be broken down into two categories: procedures performed when pregnant and procedures performed when not pregnant. Non-pregnant exams include the hysterosalpingogram, or HSG, pelvic pneumonography, and vaginography. Exams performed during pregnancy include fetography, pelvimetry, and fetal cephalometry. Hysterosalpingography is performed to determine the size, shape, and position of the uterus and uterine tubes, and it can delineate lesions such as polyps, submucous tumor masses, or fistulous tracts, as well as investigate patency of the uterine tubes in patients who are unable to conceive. It involves the introduction of a water-soluble radiopaque contrast into the uterus via a cannula. For procedure prep, the intestinal tract should be cleaned before examination and a laxative administered for constipation. Cleansing enemas may also be required before examination, and the meal preceding the examination is typically withheld. It should be scheduled within 10 days following the onset of menstruation because the endometrium is least congested at this time and there is least risk of irradiating fertilized ovum. Before the procedure, the patient should empty their bladder, irrigate vagina, and clean the perineal region as instructed, with supplies provided by the radiologic technologist. A preliminary scout image is made, then the patient is placed into the lithotomy position. The physician places a speculum into the vagina, and the uterine cannula is placed into the cervix. Contrast is injected under fluoro to fill the uterus, and should spill into the peritoneal cavity if the tubes are patent. Images should demonstrate the pelvic region, centered about 2 inches or 5 centimeters above the pubic symphysis. All contrast media should be visible, including any spill areas. A short scale of contrast is desired, with the kV range in the 70s for the appropriate attenuation of iodinated contrast. Pelvic pneumonography has been virtually replaced by sonography and other diagnostic techniques, so this presentation will not cover this exam. Vaginography can be used to investigate congenital malformations and fistulae. Thin barium sulfate or water-soluble iodinated contrast media may be used. Contrast is introduced via rectal retention tube inserted into the vagina. After images are made, the patient is asked to expel as much contrast as possible. Vaginal irrigation is used to remove the remaining contrast. This image portrays a lateral view depicting a rectovaginal fistula. You can see contrast entering the rectum when it should not. Due to radiation protection standards, pregnant patient procedures are typically preferred to be performed under sonography, so discussion is limited to procedural definitions. Fetography is imaging of the fetus in utero and should be avoided until after 18 weeks of gestation. Pelvimetry and fetal cephalometry demonstrate the architecture of the pelvis compared with the size of the fetal head. Placentography shows the walls of the uterus to locate the placenta in cases of placenta previa, a condition where the placenta covers the mother's cervix. Radiographic procedures for males include those performed on the seminal ducts and the prostate gland. For the seminal ducts, we typically see vesculography, epididymography, and epididymovesiculography. Examination of the seminal ducts is performed in the investigation of genitourinary abnormalities such as cysts, abscesses, tumors, inflammation, and sterility. Water-soluble iodinated contrast media is introduced via injection into the ductus deferens, which requires a small incision into the scrotum. Urethroscopic catheterization of the ejaculatory ducts should include images centered to the upper border of the pubic symphysis. We typically don't perform prostatography any longer. Sonography is preferred as the imaging modality for investigation of the prostate to minimize radiation dose to the gonads. A vesiculogram can be performed to see the epididymis, to screen for cancer, inflammation, and other abnormalities. In the image on the right, we see an abscess.